Now we have a report on silent diseases. Here's our reporter, Laura Windsor.
A potential threat to your health are the silent diseases that go undetected and untreated. We asked Dr. Alex Christ of Desert Regional Medical Center in Palm Springs about these silent diseases that can lead to serious complications.
Well, I think the important things that we do in family medicine as far as treatment is concerned is acting as a detective. We try to find silent diseases. Most of the patients that come to us may have no complaints actually and are there for a physical examination. And it is our job then through history and through physical examination and periclinical examinations to detect silent disease. And I think that's the most important part of our job. And that enters into the realm of prevention. I can think of a number of diseases that I deal with on a regular basis that I consider silent. The most common in the United States is obesity. It's a silent disease. It causes changes in our bodies that we're not aware of, and that's really the definition of silent disease. Another one would be essential hypertension. Even though we don't know the cause of that, it is widespread throughout the United States. And if you don't go to your primary care physician to get your blood pressure checked once or twice a year, you'll never know whether you have it. And this disease can then do end organ damage to our arteries of our body, causing strokes, heart attacks, renal failure, peripheral vascular disease, carotid occlusive disease. So it's very important to identify it, to diagnose it, and to treat it. Another common silent disease is diabetes, type 2, intimately related to our problem of obesity. But type 2 diabetes affects probably 40 to 50 million people in the United States, and another 20 million who are probably undiagnosed. Once again, a silent disease. You won't know that you have it until you come to the doctor and probably get a blood test, or he asks you several questions about the symptoms that you weren't really aware of, such as polydipsia, which is excessive thirst, polyuria, which is urination over periods of time, excessive, and weight loss. Another type of silent disease is hepatitis. Hepatitis B and C are widespread throughout the world and the United States. When you talk about screening for cancer and silent cancers, we usually go by age and by habits. So once again, going back to the history and the physical, if someone's over the age of 50 and he's a male, we usually think about two cancers, colon cancer and prostate cancer. The same thing is true for the most common cancer in women, breast cancer, and what I consider the worst disease a woman can get. Breast cancer is detectable and treatable at an early stage with the modalities that we have now. Especially in Southern California and the Southwest, we see three typical cancers: squamous cell cancer, basal cell cancer, and melanoma. And if indeed you don't have a complete examination, one can easily miss a melanoma. And the lesions are very tiny, very small, and usually asymptomatic. They usually don't cause the person a problem. They may say, oh, I've got this lesion that's growing, or something that's itching, or something that even bled once or twice, but I didn't pay any attention to it. But if they are seen by the physician and asked just a simple question, do you have any skin lesions that are bothering you? Then they're able to be diagnosed and treated at an early age. And especially in melanoma, it's very important because the microscopic depth at which that lesion is, it really determines the prognosis and the treatment. And although it's not nice to have to tell someone that we think that they have cancer, it's nice to be able to tell them that I think we caught it early enough and I'm going to send you for the surgeon for him to treat you for this. It's very rewarding. The patients never forget that. And every time they come to your office, they thank you for that. And yes, that's a great part of the business.
If you would like more information on this and other medical topics, check out health news on our website, thedoctorshow.com. For the American Health Journal, I'm Laura Windsor.